Hello again, welcome to another Meditech Quick Tips video. Today we're going to be discussing Meditech messaging. Meditech messaging is a way for routine, non-urgent messages to be sent to frontline nursing staff from physicians, nurse practitioners, physician's assistants, or any other extenders. In this video, we will be discussing the provider directed messaging. In another video, we'll be discussing the nursing response to the messaging. Any physician who wishes to send a message via Meditech would be selecting their patient on their rounding list. The Send New Message button would then be selected, and then the physician would be able to populate those fields with the information they would like to communicate. In the first drop-down box, the physician would select nursing, and then whatever nurse is caring for the patient on that day would be able to see the new message populated by the physician. They would then tab through the next few fields using the tab key on their keyboard. We urge you to use the routine priority. Any stat or urgent communications should be by phone or face-to-face. In this field, the physician might populate what information they would like the bedside nurse to have. So we'll say, please send UA today after lunch. And then they would click send to send the message. On the nursing side, the nurse then has their patient list, and they would be able to see on the status board any new messages that were available for them to read with regard to their patients. And then it would bring up the information for the nurse to be able to read the messages that were sent. So for instance, this one is highlighted. The nurse would hit view and then be able to see the information that the physician or extender had sent to them. The physician would also be able to see what messages they had sent during the day on their physician desktop. If the provider would like to see whether or not that message was read, they could click into the message, double click, and be able to see that that status was completed by that nurse and that particular time. Please don't hesitate to call the helpline for any additional information that you might need on Meditech messaging.